Hey everyone, I'm Dr. Michael Breus, the Sleep Doctor. Welcome to another episode of Wake Up Wednesday. I'm on a mission to help people get the best sleep they can, and I love hearing from you. Every single week, I answer a few of your sleep-related questions, and boy, there's a ton. If you have any questions that you'd like to see me answer, head on over to thesleepdoctor.com where you can send me an email. And do me a favor, while you're there, scroll down to the bottom of the website where you can subscribe to our weekly email that's packed with all of my great sleep tips. Okay, let's take a look at our first question. This is from Lisa B., who writes, I'm a 55-year-old postmenopausal woman who suffers from chronic insomnia. I have no trouble falling asleep, but I am like a sunflower, wide awake anywhere from 1:30 to 4 a.m. every night. I've tried all the homeopathic and natural remedies, eliminating blue light, cool room, etc. I have even tried THC sleep gummies. Please help. One of the things that we know post-menopause is that hormones can be an issue. And remember, melatonin is also a hormone, so it can get affected by some of this post-menopausal hormonal disruption. So the easiest way to fix that is to get up at the same time every day, thereby forcing your melatonin to turn off every single morning. Now, step number 2 is, what do I do in the middle of the night? Many cases, people will wake up and say, well, I'm up, I might as well go to the restroom. Most people don't know it, but in order to enter into a state of unconsciousness, you need a heart rate of about 60 or below. Well, if you go from a lying position to a seated position to a standing position, and you walk across your room, guess what? You're going to have an increased heart rate, and that's going to have a pretty big effect on your ability to fall back asleep at night. The final thing I tell people is, well, if you don't have to go to the bathroom and you're lying there awake, what should you do? Well, you really should not look at the clock if at all possible. Now, I know that's hard to do, but a lot of people will look at the clock and it raises their level of anxiety. If you wake up in the middle of the night like that sunflower, do me a favor, relax, get some 4-7-8 breathing in, and that should definitely help you fall back asleep. All right, our next question is from Anna B. in France. And she says, I'm a woman of 46 with chronic insomnia. I wake up at night, usually around 3, and fall asleep after 2 to 3 hours. Sometimes I don't fall asleep at all. This pattern has been going on for many years. It became worse when I had my 2 babies. I could not fall asleep between night meals. A full night's sleep is a rarity. I sleep every 6 months or so. I have taken the test and I'm a dolphin. What should I do? Let's be fair. Most people don't sleep the same after they've had children. So what we like to look at here is your level of anxiety and understanding what's going on in the middle of the night. So first of all, everybody wakes up in the middle of the night. However, most people fall back asleep relatively quickly. But if you've got infants around, that can be a bit of a challenge. One thing you can do is you can lower your heart rate and help yourself relax by doing 4-7-8 breathing. We talked about that just a second ago. This is where you breathe in for a count of 4, you hold for a count of 7, and then you breathe out for a count of 8. But there's another thing that's really important to think about, and this is called non-sleep deep rest. So there's actually data to show that if you lie in bed in the dark while it's quiet, not asleep, it's actually rejuvenative. If you lie there for an hour, it's worth about 15 or 20 minutes of sleep just lying there and relaxing. For this particular person who is a dolphin, once again, very common to see this situation, and we have seen really good results when people use in combination 4-7-8 breathing with the non-sleep deep rest. Our next question is from James, and he writes, I've had really bad insomnia for the past 3 months. I'm not sleeping at all. I never feel tired. I've been dealing with stress and anxiety, which without any sleep is making it worse. Any tips? When we see people who have instances of insomnia that have only lasted 3 months, usually it has to do with a singular stressor or something that happened approximately the time when the sleeplessness occurred. Now, it could be a happy thing or it could be a bad thing. The very first thing I would want to do here is look at what is stressful. So right after dinner, I ask all my patients to do something called a worry journal. Very simple, just take a sheet of paper and draw a line down the middle. Put all the things that you're worried about on one side, and then on the other side, put one step in the direction of solving this problem. I don't want you to try to solve the whole problem, but you've lowered your anxiety because you've taken the first step in being able to do that. Okay, our final question is from Larry, who says, my insomnia stems from gut issues. What supplements or herbs would you recommend for sleep? One of the first things that I tell people to do is look at your sleep position. Well, it turns out that if you sleep on your right side, that is a tendency to make gut issues worse. So step number one is, I would say, do me a favor and rotate so that you're on your left side, not your right side. And let's see how much better you sleep. Then another issue that could be going on is you're eating food too close to bedtime. As a general guideline, I tell people, please stop eating approximately 2 hours before lights out and stop drinking fluids 1 hour before lights out. Step number two, what are you eating during the day? Could that be causing you some stomach upset at night? One of the big things I know for me is dairy. Finally, the question is, are there any supplements or herbs that I would recommend for sleep if you are having specific gut issues? I would say that here would be, I would want to be very cautious. We don't exactly know what's causing the gut issues, and so adding more supplements to this could be a problem. I would also talk with your doctor and make sure that you don't have something called gastroesophageal reflux disease. So before adding any supplements or herbs, if any of the ideas that I've presented so far don't work, you probably should talk to your doctor before adding anything extra. Well, that's it for Wake Up Wednesday. Thanks so much for all of your questions. And remember, if you have a question that you'd like to have answered here, send it to me in an email at the ask@thesleepdoctor.com. Also, be sure to subscribe to my weekly newsletter as well as my YouTube channel, where I'll be giving you the most current and relevant answers to your burning sleep questions. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.